So now I invite Leander Swinnen to talk on his findings on microvascularity in Dupuytren's disease on ultrasound images.
Okay, hello everybody. I will keep this very brief so we can enjoy our lunch soon. I would like to thank Professor De Greef for supervising this project, and I would also like to thank Quinten Dierenand, who's also here today, who assisted me in writing this paper. So, firstly, why would we look for vascularity in Dupuytren's disease? We all know the strong association with lederhoses. And one study found that in 8% of patients there is an intrinsic vascularization present. Another recent study about Dupuytren's disease that looked at ultrasound features found that 10% of patients showed hypervascularity, although this was not their primary endpoint, so it was described very vaguely. You can see the picture on the bottom right of the slide. So, more importantly, why would we look for vascularization? I predict that it has some kind of prognostic implication. Seeing the increasing role of ultrasound, it seems to me that it's very important to look at all features of Dupuytren's disease. So, our patient is a 56-year-old male. He has a medical history of a pre-existing nodule represented by the blue dots. So the pre-existing nodule is on the fourth ray of the right hand and is non-progressive in nature. It has been there for the last 10 to 20 years. Now he comes to the clinic with a newly formed nodule, a little bit distally from the first one, more located towards the PIP joint. Our patient has an extension deficit of 20 degrees, and he also reports tenderness of the nodule. What's really important about this nodule is that it's progressive in nature. It has started in the last 6 months and has progressed rapidly. So when we look at these nodules under regular ultrasound, you can see the top two pictures are from the newly formed progressive nodule. It shows classical signs of ultrasound images of Dupuytren's disease, meaning it's like hypoechogenic. I think this was also studied in a Dutch study where they said that hypoechogenicity is related to faster disease progression. The bottom image is also from this patient. It's from the older nodule that's non-progressive. So when you put on advanced power Doppler or microvascular flow function on the ultrasound, you can see inside the zones where the Dupuytren tissue is located, there is a very strong signal of vascularization. In comparison to this, on the bottom image, you can see there is almost no signal. It shows a classical view of a Dupuytren's nodule with only some peripheral blood vessels. So what can we make of this? The rising question is actually what kind of influence does vascularization have on the prognosis, and why does this happen? What are the cellular mechanisms behind this? Maybe there is a newly formed blood vessel, maybe there are persisting blood vessels in this patient. It's a little bit in contrast with one histological theory that suggests a form of constrictive remodeling, which means there is endothelial proliferation and luminal narrowing, which stops flow inside of the nodule and gives rise to a hypoxic state, which in turn leads to more fibrosis. Why is this finding important? In this patient, we can see clearly there is an association between vascular flow and disease activity. So the question is, what is the prognostic value of this vascularization? Can we better time our follow-ups or interventions? And so lastly, can we better do a risk analysis based on ultrasound? This can also give rise to new therapeutic targets. One thing that's certain in this case is that it's related to a more aggressive disease phenotype. Because at Leuven we practice what we preach. We already started research on this topic. These are new findings from other patients from a prospective study we are performing right now. These are 4 patients of the 11 we already measured, and these all show vascularization inside of the nodules. We will follow them up longitudinally and compare to the non-vascularized patients and see if this has any meaning. So the take-home messages, this is a very novelty observation. I suggest there is some kind of vascular component in Dupuytren's disease, and we need to further explore the prognostic value of ultrasound and specifically the vascularization components inside of the ultrasound measurements. And this gives rise to future research. Thank you for listening. Any questions?
Surely there must be a question.
Thanks very much. We've been making use of the microvascularity in assessing the patients with Dupuytren's and Lederhosen using thermal imaging. You see here, very nicely seen because it's hotter on the thermal image.
Yes.
So it's a new way of looking at this disease. So what you've shown us is of great interest. Thank you very much.
Thank you.
Inspiring.
Can I ask, do you think the cold nodules being more progressive, which is what they showed in the paper, do you think that's just a function of them being older? So it's just time, and actually the vascularity's got nothing at all to do with progression?
That's possible. It's very new, a very new topic, so I'm uncertain about what the meaning of the vascularity might mean. We are now looking at it, but maybe this is just an incidental finding that happens in some patients, maybe because of the constriction in the endothelial proliferation of the blood vessels. These patients still need to have their blood vessels closed off and then ending in a sort of residual disease stage, I think.
So, yeah, another, Charlie, yes.
Not quite a question, but this likely represents the degree of inflammation. In unpublished work, we found that people who need their first procedure younger than age 50, they are twice as likely to have tenderness in their nodules, and half again as likely to have itching in their nodules. And nodules are frequently pink as well, which goes along with the inflammatory component. So there may be a overall genetic predisposition, or there may be that this is early on in the stage. So,
yeah, that's what I try to suggest also, is that there is a correlation with a more aggressive disease phenotype in the patients we measured recently in our prospective study. They are also mostly younger patients with younger onset, and then also these inflammatory symptoms like itchiness and tenderness of the nodule. So, yeah.
Thank you, Leander. I just want to add a philosophical thing to this. Leander, as Joost and Quinten are students of me, and they come with new ideas themselves. And that's also a new way to look at things. He's very enthusiastic, invented this theory and this practice, and I just have to find a way to make it possible. So, but that's also very adding things to us, because we've seen so many complex things here, and sometimes we have to go back to the question, how can we use it in daily practice? It's sometimes difficult to understand, but on the other hand, also we get focused in the way we think, and the way we do our research, and having these own initiatives by these young students. I really appreciate this, and it's an eye-opener, I think, for all of us. So thank you very much for it.
Thank you.